I'm going to start off the show asking Dr. Forty to explain exactly what palliative care is.
So very simply stated, Joan, palliative care is care that's directed at quality of life and symptom management in people with a chronic illness. So I like to think of it as I let the other doctors worry about the disease, we try to worry about the person.
Okay, well said. Now, on a previous show, you and I talked about hospice care.
Mm-hmm.
Can you clarify the difference between palliative care and hospice care?
Sure. Palliative care, as I said, is care directed at quality and symptom management and helping people to deal with a chronic progressive illness from the beginning to the end of that illness. Hospice actually supplies palliative care, but at the end of life, when there's no treatment directed at the disease that has any reasonable expectation of helping. So actually the government defines end-of-life care or hospice care as 6 months or less if the disease runs its normal course. Mm-hmm. But at that point in time, the total care is directed at comfort.
Okay. Now, who qualifies for palliative care, age-wise, stage of illness-wise?
There's no limitation. Anyone with a chronic illness that is progressive is essentially a candidate. So we take care of many different diseases. For instance, I think that when people think of palliative care, they oftentimes think of cancer care, but we take care of people with heart disease, we take care of people with kidney disease, we take care of people with blood disorders who have symptom management needs. So it's anyone, and the age range is really virtually any age.
Right. So we can include pediatrics in that.
Well, yeah, but usually we don't see pediatrics because, for several reasons, not the least of which is, thank God, pediatrics doesn't have a lot of chronic progressive illnesses.
Okay. Now, how does someone request palliative care?
Well, it's, as I said, you may not need to request palliative care. Your doctor may be doing it. But if there are symptom problems that come up and the doctor is unable to do it himself, then he oftentimes will request a palliative care consultation. Certainly families or patients can also ask for it too, and to help them to get through their illness.
Right. I would think we would rely on the physician because I think at this point in time, not many families, understand or know about palliative care. So my next question was going to be, who decides when a person needs it? The patient themselves, the family, or the physician? So generally be a physician that would recommend?
The answer to that question is yes. Anyone can request it.
Okay. All right. Is there a time frame or a length of time how long someone can receive palliative care?
No, there's no time frame. Again, the earlier we get involved, generally the better. If over the course of an illness, a patient and family doesn't feel that they need too much of our services, we always just provide them with our contact information, and as things change, they're welcome to call us.
So that I have the right understanding, so when a patient is physically in the hospital, chronic illness, and it's suggested consult is put in for palliative care. That's where it takes place. So the patient goes home, right? Then the patient comes back again. Do they pick up again with palliative care?
Sometimes. It depends on what they are readmitted to the hospital for. If they have pain or symptoms that, again, require our assistance, then absolutely. Or if their disease is progressing and they're becoming more ill, then yes, we get involved.
Okay. When I was working at Staten Island Hospital, we had a trend towards alternative medicine, looking holistically at the patient. Does palliative care have anything like that, or suggest, I'm thinking about massage, yoga, meditation?
Sure. Well, that's why palliative care, it's really a team approach. So the social workers that are on our team, they provide supportive counseling. We look to seek, complementary type of therapies depending on what the patient responds to. Guided imagery, music therapy, things like that are things that we are going to be introducing shortly. But yes, it's a team approach, and that covers that as well.
Yeah. Is there anything else that we can do to get the word out there about palliative care? Anything that we're not doing, nurse-wise, or?
I think the only thing that happens is that people sometimes think of palliative care and hospice as an end-of-life type issue, but it's not. It's an issue of helping people to live. As I said, palliative care works with the attending physician. We want people to get better and live a normal life. But we also want people to understand and to be able to honor their wishes, too. Oftentimes, I think we're stuck in a situation where the way we've presented a particular item doesn't present both sides of the coin equally, only because we think about the importance of doing oftentimes rather than not doing.
So I would like to just say that palliative care is more on the upbeat side of the coin.
Oh, certainly.
Right? Because you're looking towards the future. You're not afraid of the future. You're looking towards the future, and with help and assistance, and to enjoy that better quality of life.
Yeah, I think if you look at it, no matter how many days I have, whether it's 1 or 10 or 100 or 1,000 or 1,000,000, I want to live the best life I can for that time. And that's really what it's all about. It's living the best life you can.